Hi, my name's Nejra Zalk, and I'm a psychologist working at the Dyson School of Design Engineering. Today I'll be talking about pain perception from animated faces. Now, learning to interpret facial expressions from a patient during medical examinations or different types of procedures has been one of the key focus in medical training. Visual feedback, including static information conveyed by the patient's general appearance, but also dynamic information, such as changes in the patient's facial expressions, communicate more information than just verbal and vocal messages. Studies have found that more than half of the total impact of a message from a patient to a general practitioner is via nonverbal components of communication. And nonverbal messages can be conveyed by someone's general appearance, personal hygiene, clothes, etc. during their interaction with the GP. Now, visual perception through facial expressions during primary medical examinations, such as manual palpation, is often used as a feedback modality to assess a range of hypotheses for diagnosis. And in fact, most of us have been palpated when we visited a doctor at some point. So when patients experience discomfort or pain, they tend to communicate their feelings through nonverbal and verbal channels, but primarily through facial expressions, and these are the most commonly exhibited reactions during medical examinations. Now, when properly interpreted, information related to the pain experienced by the patient conveyed to the examiner by facial expressions is sometimes more accurate than just verbal responses. But if the observer, in this case the GP or trainee, wrongly diagnoses the severity of a patient's pain, this could result in mistreatment and even mortality. Pain perception is a very intricate research area in psychology. We know from a lot of research that intrinsic and extrinsic factors in both patients and physicians increases perceptual subjectivity when perceiving visual feedback. But what about different kinds of faces? Now, it's really important for anyone studying to become a general practitioner to experience treating patients of different demographics and backgrounds, because misjudgments in visual feedback due to subjectivity could result in distrust between patients and health workers. Unfortunately, this type of work is still in its infancy. Not only is it difficult to judge pain on other people's faces, emotion perception is generally very difficult and not at all universal, as is typically assumed from early studies. For example, if you didn't know anything about the individuals on these photos, what emotion would you think their faces were conveying? You might say that they are sad, angry, and joyful. Now, these types of facial expressions can be relatively easy to read, especially as some of the contextual information is already conveyed. So, for example, the girl who looks sad has tears on her face, and the guy who looks happy has a fist in the air. But there are more intricate emotions expressions which can be very, very difficult to interpret. What if people that we're watching have faces we're not used to seeing? Because, for example, we've mainly been used to seeing white faces. What if we only see parts of the face because it's partially obscured or the person is leaning away? What if it is unclear what the context is? For example, this could be a person who's thoughtful or pensive. This could be someone who is enjoying the music they're hearing. And this could be someone who looks annoyed. But then again, all of these are guesses, and it's not clear from lack of context what these people might actually be feeling. For instance, the guy that looks happy might also be shielding his ears from the loud music. Now more than ever, in this post-pandemic world where people will be wearing all manner of facial coverings, it's really important to understand how to read faces properly in different contexts. What about the person who is perceiving the faces, the so-called eye of the beholder? Depending on who we are and what context we've been exposed to, we have different outlooks on life. Individuals differ on personality traits, including how emotionally attuned they are to their own feelings, but also the fact that some people are prone to be anxious and therefore tend to infer more anxious cues from other people's faces and behaviors. All of these factors might interfere with the correct interpretation of facial expression of pain. Together with doctors Trish Nayakara, Mazdak Gujari, Fumi Alida, and Simon de Lusignan, I'm working on a project focusing on developing a robotic patient that will have the capability to respond to palpation techniques in a realistic way. You might have heard some of the other presentations on this particular project, so I won't go into it in detail, apart from saying that the overarching objective of the proposal is to develop the first generation of robot-assisted training methods for physicians on physical examination of patients, given perceived constraints such as pain and unpleasant sensations. Now, my work in this project is focusing on the facial expressions in terms of both what facial expression the robotic patient is emitting, but also the emotional expression and emotion decoding of the user, in this case, the medical students. Before we get started with the project at large, we're going to be doing a quick study to understand how this whole thing works. One of the underlying hypotheses that we'll be testing is that a number of user characteristics might interfere with facial pain perception, including viewers' own ethnicity, personality traits, and anxiety. And what we want to know, first of all, is whether individuals with different cultural backgrounds and variations in personality and behavioral traits perceive pain expressions on an animated robotic face, both in terms of identifying the correct emotion, that is pain, as well as its level of intensity, going from low to medium to high levels of pain. So we're going to be doing a survey where we'll be showing short video clips of faces that look something like that. We aim to provide a variation of faces, both in terms of ethnic groups, because that is largely lacking from the literature, but also in terms of intensity of pain. We will ask participants to identify what emotion they see and how intense this emotion appears so as not to bias their answers. So we won't be telling the participants what the faces are feeling. We will remove all the contextual information. They also won't know whether they're watching male or female faces. Besides for these questions, we will ask participants about perception of realness and presence when seeing these faces, their own levels of anxiety and depressive symptoms in general, their personality traits, and their demographics, because all of these are variables that might interfere with emotion perception. Now, this study is yet to be done, but we do have certain expectations when it comes to results. First of all, we expect to find differences in pain perception between people of different ethnicities, such as white, black, East, and South Asian ethnic groups, and a bias toward emotion perception of pain on faces from one's own ethnic group. And this expectation is based on research that shows that as children are growing up, they're mainly exposed to faces in their own culture and can therefore struggle with emotion perception from other types of faces. We also expect that high levels of participant anxiety will interfere with their own pain perception, and that personality traits such as emotional instability, sometimes called neuroticism, is expected to correlate with the ability to correctly identify pain from the animated faces. All of these results will help to inform the future design of the robotic patient. If you have any questions about this presentation, please email me and get in touch. Thank you for listening and stay safe.